Okay, hello everyone. Good morning again. For those of you who have just joined us, either here at the Stone Center or online, my name is Adam Sotok and I'm the director of UNC Rural. Thank you for joining us for our Serving North Carolina through Rural Partnerships event today. I'm very excited about our second session of the day that's about to start. Understanding how culture and context shapes young adults' perspectives on mental health in Dare County, North Carolina. Just a show of hands, who has been out to the coast to Dare County before? Okay, most folks, yeah. We'll be talking about work that's happening in Dare County. And UNC Rural is proud to say that this collaboration is currently one of our Research Engagement and Advancement Fund awardees. Now I'm going to turn it over to Dr. Marilena Excellent and team.
Good morning, everyone. Awesome. Thank you so much. Is it okay if I borrow that chair, please? Thank you so much. I will formally introduce myself later, but I came a couple of years ago. I came to the conclusion that whenever I teach now or present at a conference, regardless of how many time I have, 15 minutes, we still have 1 minute chair yoga. So if you don't mind, I invite everyone to engage. Perfect. Everyone likes standing. No. The reason for doing chair yoga is to be inclusive. That way, if someone has any mobility restrictions, they don't feel excluded. All right. Let's take a deep breath and then we're going to close our eyes, have our feet rest on the floor, and rest our hands on our lap. We're going to start with a breathing exercise 3 times. We're going to inhale through our nose and have our shoulder lift up. And then we're going to exhale slowly through our mouth to release the stress and concerns that we might have. Let's try again. Inhale through our nose and exhale through our mouth. One last time. Inhale through our nose and exhale through our mouth. Wonderful. Now I invite you to open back your eyes. And now what we're going to do, hold the back of our chair. And then we're going to have our left hand. Awesome. We're going to have our left hand, just make that cross. And then we breathe. Wonderful. We come back to center. We're going to do the opposite. And we breathe. Wonderful. We come back to center. We're going to lift up in the air our both arms. And then we're going to lean to the left. And we breathe. We come back to center. We're going to lean to the right. Wonderful. We come back to center. We're going to lean forward. This is where we want to go. Awesome. We breathe. We come back to center. We're going to lean backwards. And at that time, you might find or feel your spine cracking. That's perfect. Awesome. We come back to center. Now we're going to do the namaste sign. And we're going to have our left elbow rest on our right thigh, like this. And we breathe. Wonderful. We come back to center. We do the opposite. And we breathe. Wonderful. We come back to center. And that's it. We give ourselves our warm hugs and tell ourselves how much we love us. Thank you. Namaste. Yeah. Oops. Perfect. Was it helpful? Thank you for engaging. Okay. Now, a few words about myself. I serve as a faculty at UNC Chapel Hill Gilling School of Global Public Health, and I also co-lead the Global Health Concentration. So I'm a twice Fulbright recipient, and I have to give a huge shout out to Carolina Center for Public Service because I do a lot of global health research, and I was so thirsty to serve North Carolina, and they gave me that opportunity. So thank you so much. I give credit. And now moving on to reassessor role. So, and hopefully, fingers crossed, that we'll move into federal grant next time. So my research focused on HIV/AIDS and mental health domestically and abroad. Enough about me. Now, the VIP in the room is my dear esteemed community health partner, Dr. Sheila Davis of you.
Good morning. It is my pleasure to be here. I actually drove in this morning in the rain from Dare County. So a little early morning, but I like mornings, and it was a peaceful drive. So very centering, but it is such a pleasure and an honor to be here. And she said, I'm the VIP. No. You'll hear, as you hear from her later today, Dr. Excellent and her team, really, they're such a fabulous group to work with. So it's been an honor and a pleasure in Dare County to partner with them. A little bit about me. I currently serve as the Deputy County Manager in Dare County. I am also the DHHS Director and the Public Health Director. And in small counties like Dare, we're considered a rural county, it is not surprising when you wear multiple hats. That's probably a few too many, maybe, but it's just what happens in small communities. I also have the pleasure of serving as an adjunct faculty member here with the MPH at UNC program, and that's just a joy. That actually is probably one of the highlights every week when I get to engage with students. A little bit more of my background. I served for 8 years as the mayor of the town of Kittle Hills. It's one of the municipalities in Dare County. And I feel like that's worth noting just because it really gives some great perspective to be able to pull in the government perspective as an employee, but also as a former elected official. So when you're doing community engagement work, it's kind of a nice thing to have those multiple perspectives. And then I have the pleasure of serving on lots of different committees and boards through my roles in the community. But I think one of the fascinating things that I hope that you'll hear today through our presentation is the power of partnerships. And that is such a strength in public health and in rural health and rural communities. And I think we'll be able to highlight that pretty well today with what we're sharing. Quick disclosure, there are no conflicts of interest for us to disclose here. And we're thrilled that this project was supported by the Tar Heels Bus Tour. UNC received a $10,000 grant to do this work. So very pleased about that. I'm going to, wait 1 second before we jump into this video. So we're going to talk a little bit before we get into the work that was done with kind of framing the work. And we thought it was appropriate to share this it's a trailer about a video that we did. So the work that happened with this study really focused on what was happening in our community around suicide. And sadly, we have some statistics that we're not really proud of in our community. We were aware of that through the community health needs assessment and through communications with our stakeholders in the community. And we have a task force that was developed a number of years ago out of the community health needs assessment. You all public health know we need to do that every 4 years. We do it every 3 years in collaboration with our nonprofit hospital. But we're going to show you some data later. But one of the things that we certainly realized from the community health needs assessment was that there was an issue in our community related to suicide, but stigma in general. So the Breaking Through Task Force, which is chaired by one of our health educators in the public health department, worked with our community to put together this video. It's about a 27-minute video. We're not going to share that. We're going to share the trailer, which is just about 3 minutes.
In the United States, we have a substance use and mental health problem. These problems, while they may be common, can contribute to a variety of premature deaths, including death by suicide.
My dad was a wonderful, hilarious, kind man. He made everybody laugh. The emotions and the feelings that you go through, especially with suicide, it's a lot. It's angry or sad or both at the same time.
This mental illness and suicidality does not have a pick or choose methodology. It can touch anybody, anywhere, anytime. Mental health is something that can be difficult to recognize because we don't always take care of ourselves. But it truly is an illness like any other chronic illness.
There's always someone out here that will listen. There's always someone out here that will grab your hand and say, I got you. That you don't have to be in the dark.
The hope would be that there is light at the end of the tunnel, and there are resources available, and there are people like me, lots of people like me running around that are pure support people that know what you're going through because we've been there. And all it takes is to pick up the phone or start looking for those resources.
He seemed very, very paranoid and scared. So I think he was terrified. He apologized several times to everyone, to God, to us, the grandbabies, and that he just felt extremely lost and didn't want to burden us with it.
Perfect!
Yay!
That's perfect. So good. Look.
And I just miss him so much. And I think about him all the time.
There are simple steps you can take to help someone who is in emotional pain that may save a life. Ask, are you thinking about killing yourself? It's not an easy question, but studies show that asking an at-risk individual if they are suicidal does not increase suicides of suicidal thoughts.
Don't let yourself get low enough to get to the point of suicidality.
There's always hope. As long as you're breathing, there is hope.
Thank you. So this video took amazing courage, as you can imagine, for those who participated. These are residents of Dare County. They're citizens who have been impacted by suicide. So when Dr. Excellent reached out after they were looking at their own data, and one day we emailed out of the blue and just like, hey, can we talk about the potential of partnering? It wasn't a matter of were we embarrassed or ashamed. It was like, let's learn more. Let's see what else we can do. This video had just been released not too long before that phone call, and I shared it with her. So it was just kind of like, yes, we are poised and ready, and our community's ready. They're ready to do more and try to understand what was going on. And that really was kind of the impetus for this union that we had. I don't know if I'm hitting. Oh, so and I think you all may get a copy of these slides, but the full video, if you have interest in watching the full documentary, is available on our website, and it's the link here as well. So the title of our study was Understanding How Culture and Context Shapes Young Adults' Perspectives on Mental Health in Dare County. So while the suicide data maybe prompted a lot of the initial discussion, it was looking broader at that as what's happening with the mental health landscape. And so our research team, our study team, is led by Dr. Excellent and a number of individuals comprised from UNC Chapel Hill, the health department, and different departments within UNC. Also, Judy Schmidt is here in the back as part of our team. Some of you also may know Lori Everett. She couldn't be here, but LaTanya Clark from UNC, and then a couple of our staff members, Samira, also with the MPH program, and then two of our team members in Dare County, Kelly Fleming and Michelle Wagner. So I was pleased to see how many people raised their hand that you had been to Dare County. It certainly is a beautiful place to visit. That's probably where most of you are familiar with it. We are on the easternmost part of the state. The little map there literally is us hanging out on the coast there. We have a year-round population of just above 38,000 people. But in the summer, which is what we're known for our tourism industry, we blossom to about 350,000 people. So kind of an interesting dynamic. For about 4 months out of the year, we are no longer a rural area. And our industry, what's thriving our industry is everything that supports tourism. So interestingly, we are a large county. If you go from Duck all the way down to Hatteras, it takes you a little over an hour and a half in the off season. In the peak season, when the 350 to 375,000 people are there, it could take you a couple hours to go from one end of the county to the other. And while we encompass 1,563 square miles, less than a third of that is actually land. So a lot of it is water and coast related. We have 6 municipalities. So in addition to the central government being Dare County, there are 6 independent municipalities. They have their own mayors, their own police force, their own elected officials. I am really proud to say that in Dare County, we work really, really well together with our municipalities. In some communities, there's some friction, but I think by the nature of how often we have to come together to prepare for hurricanes, and we have to coordinate with one another with our emergency management, our preparations, our communications. You can't put an evacuation in order in one town and not another, because that's not going to work. You have to pass through the different towns to get out of the area. So over time, we've really developed strong relationships, and that's kind of encompassed all aspects of government. I think I'm being effective with clicking. Oops. So this is a picture of our health department. We are a consolidated agency in Dare County. So we are a health and human services department. We encompass public health, social services, and veterans. And we used to have 2 standalone buildings, and about 3 years ago, we combined the buildings so people have a one-stop shop to come in and get the services they need. It's been certainly one of the advantages of consolidation. So specifically looking at the study, the learning outcomes that we set to hope to achieve, which I think we did, but we're evaluating the influence of cultural, financial, and systemic factors on mental health perceptions and the service access, or array of services in Dare County. And, we knew going into it that stigma had continued to be an issue for people accessing those services. So we really wanted to understand more about the hows and whys, and potentially some solutions of what we could do to address it. So a little background to, set the landscape of why we knew we needed to focus on this. I mentioned the community health needs assessments that we do. We have a group in Dare County that facilitates that process. It's led by public health, but we have a group called the Healthy Carolinians of the Outer Banks. It's a coalition of stakeholders throughout the county. It includes nonprofit leaders, the EMS director, individuals from Outer Banks Health, the local hospital, medical providers, community representatives. And this is the group that when we compile the data every 3 years and then evaluate it and determine priorities of what we're going to focus on, this group's help steer that direction. And I mentioned the Breaking Through Task Force. That's a task force that actually was developed out of one of the community health needs assessment. Another task force that's specifically focused on the substance abuse side is the Saving Lives Task Force. Interestingly, same thing, it kind of was born out of the community health needs assessment, started as a task force supported by the health department and the Healthy Carolinians of the Outer Banks, and then it turned into its own 501c3 nonprofit. So it's kind of interesting, some of the progression. But if you look specifically at the data that we were looking at, the 2021-22 Community Health Needs Assessment identified mental health as a key factor contributing to our mortality rates. Also noted was, I mentioned this, the death by suicide. For individuals ages 20 to 34, it was the second leading cause of death in our county. Certainly not a statistic that we are comfortable with. And Dare County suicide rate, the rate of 19.3, was significantly higher than the state's rate of 13.4. Mental health and substance abuse have consistently ranked as the top one, in the top 3 of our community health needs identified by the public themselves. If you're, thinking back to community health needs assessment work, you do primary data and secondary data and see if they match. So our primary data that we collect through surveys and focus groups, is telling us that, yeah, the data is true. We feel this is a pressing need in our community. This is one of the slides when we do community presentations after our community health needs assessments to educate the community on what we see in the community health needs assessment. This is one of those slides that specifically relates to some of the data related to mental health. And so, things that, concerns related to core mental health days or suicide rate, again, just statistics that we knew we needed to keep working on. So the methodology, how are we going to learn more? How are we going to partner and make this happen? And so I felt like a couple of months anyway, we worked on very hard as a team, the team that I showed you a few moments ago, on developing a survey. We wanted to get more community impact specific on this topic. So, it's a broad survey when you do the community health needs assessment, but now we really wanted to focus on answering the questions that we had proposed. So the team worked in developing a survey about 34 questions. And we had phenomenal response. We had 4,363 people respond to that survey. Remember, our population of 0 birth to senior citizens is only 38,000. So we were really pleased with the response rate. And I think that's where, when you have a partnership between an academic institution, the credibility with UNC, and then local partners that are already have the relationships in the community, we were able to get the responses by going out and asking people and sharing it. There was a strong level of trust to be able to complete that survey. We also conducted interviews. We had 7 individuals that had lived experience that we did some interviews with, and then 2 focus groups, 2 different sessions with 8 participants in those focus groups. And we had standardized questions that we were able to ask during the interviews and the focus group sessions. From that, a code book was developed for the qualitative data analysis. And then a thematic analysis of the interviews and focus groups was done using the in vivo software. And that's really what helped us learn a lot about the multifaceted aspects of these challenges, which going into, but now you have data to quantify that with. And these were really helpful in helping us gain more knowledge and understanding about the challenges and barriers that were facing people related to mental health, especially, this particular population. I'm now going to turn it over to Dr. Excellent to walk us through our findings.
Wonderful. Thank you so much. So here are the results. We'll start with the survey, and then we'll move to the qualitative data. So we wanted to make sure that we have a mixed method study design to make sure that we capture, because our focus was understanding what is going on. So, okay. So what we hope to show you is that the majority of the participants fall under the age range of 26 up to 29 years old. But our targeted population was 18 up to 34 years old. And then we had most of the participants reported themselves as male. And then we asked the question, we wanted to understand, we were curious about what might be some of the key challenges that the community face when it comes to accessing mental health services or just talking about it. So let's move into a graph to better understand. So, oops, I went too fast. Okay, so the top 6, so these are the responses that we got, but the top 6 were health insurance. Second, transportation. Believe it or not, this is a real challenge in Dare County. Concerns about confidentiality, lack of trust in providers, scheduling conflict, lack of awareness about resources, and of course, childcare. So the purpose of the study was not to do any intervention, but to understand the bottom line behind that high rate of suicide and also why people were not accessing services. This slide actually summarizes the current mental distribution. So we ask participants about your level of stress. And what you can see is that about 35.6% of the participants fall under the category of frequently overwhelmed or distressed and severe mental health challenges. That's huge. Now that we have asked them about the challenges, we also asked them about what do you do for your mental health? And these are some of the data. To who do you feel the most comfortable to talk to? And we gave them some categories. So based on the data that we collected, parents were the go-to predominantly, followed by spouse and partners, followed by siblings, followed by friends, followed by mental health providers. But we would like to draw your attention to that number. Prefer not to answer. That really rings a bell for us. 919 participants out of 4,000 reported, I don't want to talk about it. When we asked them, who do you feel the most comfortable talking to? What word would cross your mind if you see something like that? What might explain that? It starts with an S. Shame, stigma. So we wanted to dive into it. So we did some interviews and focus group. So let's dive into the result that we got from the interviews and focus group. And for the purpose of this presentation, we didn't want us, community and academia, to interpret our understanding of what participants are saying. We thought that it would be more impactful to actually share the words that they put in, they said. So that's why you will see a lot of quotes instead of us trying to explain things. So one of the major barriers that they identified was therapist availability, the relationship. So they raise access to therapists, transportation, just like similar to the survey, affordable treatment, cost. And here are some quotes. Mental health is not a luxury. How many of us agree with that? It's not a luxury. Access to a therapist should be as normal as access to any primary care physician. Now, in terms of transportation, access to care shouldn't be determined by one's ability to travel. The distance to healing should not be a barrier. That's unacceptable. Affordable treatment. Mental health shouldn't cost more than the pain of not receiving it. Because not receiving access or not getting access to mental health services can lead to someone dying by suicide. And let's remind ourselves that suicide is preventable. Other factors that they list is the wait list. Sounds familiar in our healthcare systems. Overwhelmed therapists. They are also burnt out. Not enough. So when therapists are overwhelmed, patients are left waiting. Mental health care shouldn't have a backlog because you don't know if people can wait or not. Therapy in other language. So the reality in Dare County is that we have some part of the population who are bilingual English, Spanish, and some other residents are only Spanish speaker. And mental health, we all can acknowledge that it is a sensitive topic to talk about. Lots of stigma still around it. So now having a third party in your room to have that conversation that you're not even comfortable with. Remember those 919 who don't even want to talk about someone I'm comfortable to. And now I have a stranger I have no idea about, and you're asking me questions. So language should not be a barrier to mental wellness. Everyone deserves therapy in their own voice. Now, let's call the elephant in the room stigma, because it is real. So these are some of the quotes that the participant shared with us and reported as why they do not seek mental health services. Shame, a feeling of shame and embarrassment during crisis calls. How many of us are familiar or aware of the 988 number? If you can raise your hand. Okay, so we still have some work to do. Not everyone raised their hands. So 988 is the crisis line for mental health. Here's a quote. Sometimes when we respond and people are going through crisis, they are embarrassed that it came to that point. So the neighbors are looking around. So a lot of people are getting into your business. You feel embarrassed and kind of shame. Law enforcement and fear of job loss. If you're not aware of that, this is reality. Nobody wants to talk about their mental health at all because if you say the wrong thing, then they will take your gun and you cannot work. You're laid off or there's no promotion. Then you are not making enough money and you get into that vicious cycle. The impact of the workplace culture on seeking help. Somebody might see you differently if you report that, well, I think that I'm feeling depressed. Do you mean that you want to kill yourself? And then they put a label on you. Other aspect of stigma is the community perception of mental health and mental well-being. We have our frequent flyers, people who are dealing with mental health issues daily. Neighbors will call and say, laptop, we redacted the name. Laptop is acting crazy again. It's very stigmatizing, not realizing the underlying causes of what's actually happening in that person's life. Mental health in the medical field. I've had multiple patients who say, I don't want you to look at me the wrong way because I'm on methadone. So judgment, the fear of feeling judged. They feel ashamed for taking steps to recover, even though it's the right thing to do. Religious and cultural barriers. In some religious groups, people are hesitant and culture. People are hesitant to seek help because they follow a pastor who tells them, no disrespect to any faith leaders, because they follow a pastor who tells them to rely on faith. But I tell them, you need to believe in yourself first before you believe in something bigger. This is not my words. This is not the research, our research team words. These are quotes from participants. Systemic barriers for law enforcement. If you disclose that you need help or support, the culture identifies you as weak. Now, who would like to be labeled as weak? Raise your hand. None of us, right? So what happened? We suck it up. We keep it inside. We tell ourselves, we try to convince ourselves that we can handle it. Because this is the expectation of the culture. And your potential for promotion goes away. You can forget about it once you disclose that you need help. You don't need even to bring the word suicide or suicidal ideation, just that you need help and support. So as a community, we have a lot to do. So this is just an infographic to summarize some of potential solution. We don't have the magic solution, but we believe that bringing in therapists in Dare County might be helpful. Making sure that therapy sessions are more affordable, cost-wise. Addressing insurance-related factors, because we see that health insurance was on top of the list among the barriers and challenges. Free screening for mental health services. Transportation, it's real, because in Dare County, as Sheila nicely presented, if you may live on the part of the island and then you need transportation, and that's a cost associated with it. Postpartum education, high school education, because remember the age range that we're looking at, 18 up to 34, but the majority of participants falls under 22 up to 29. So here are some potential solutions from the participant perspective, not our perspective. Regarding affordable and accessible care, what can we do? They believe that mental health services need to be affordable so people don't have to worry about paying out of pocket when they need help. They believe that it's important to have a holistic approach to well-being instead of silo services. We need something that addresses the environmental, financial, and seasonal factors that impact mental health. So now, when they say seasonal, you need to understand a little bit of context. If you travel to Dare County, probably this is when you travel to Dare County during the summer. It's beautiful. It's like paradise in North Carolina, right? How many of you would disagree with that? Great food, nice sunshine. Oh my goodness, the ocean is amazing. However, try to take a trip in December and January. It's like a dead zone. And that affects us as people, as human beings. That leads to depression, you're in the dark. Most importantly, your income is gone because it's a seasonal count. They believe that to reduce, we need to work on reducing stigma more and having more visibility around mental health well-being. So they think that having immediate access to mental health support will help. For example, having someone that we could call who would be there in a timely manner would be beneficial, especially at 2 or 3 o'clock in the morning when there's no one else to call. Community-based education and awareness, they believe that we should do that. The county health system could do workshops, they could do Zoom calls, they could make flyers, but until people actively make the choice and the stigma is wiped, it's difficult. Because even attending those sessions or those events would mean what? That you're in need, and then you don't know how your community gonna react to your attendance at these events. So stigma is real. Financial stability for well-being, supporting year-round employment opportunities could help maintain people's well-being. But of course, because if you have to think about where my lunch gonna come, where my dinner, if anything, you cannot be mentally stable or mentally healthy. Language access for Hispanic community or Latino community. We need better language support for the Latino or Hispanic community. The language barrier is a huge obstacle, and there are limited therapists who are bilingual in their county, for your information. So in conclusion, and next step, what did we do? We collected all those data, we felt overwhelmed, and we felt the urgency to collectively, what can we do? So now credit to Dare County because they were already doing some work. So those findings give them the context and a better understanding of what the community is actually facing and what they recommended, not us thinking. So in conclusion, despite available resources, because there are some resources available for mental health services, including the Breaking Through Task Force and all that great work, a significant gap in mental health support persists. And stigma play a critical role in that. So our qualitative findings, interviews, and the focus groups underscore barrier to accessing services, including financial constraint, transportation difficulties, cultural perceptions. And when we talk about cultural perceptions, it's not only based on the location and the county, but also we saw in law enforcement, what is the culture? You cannot say something that would make your colleagues or your supervisor believe that you might need some mental health assistance. And definitely a shortage of local therapists. So our community academic study provides a comprehensive analysis of the mental health perceptions and challenges faced by young adults in Dare County. And the project highlights the need for increased mental health resources, support, awareness to reduce stigma, because that's the bottom line. And then these data emphasize the significant role that cultural and contextual factors play in shaping mental health perceptions and access to care. So we are very grateful and humble that the community, with the trust that they have in their county leadership team, really opened up to share, because they knew that we would report anonymously the aggregate data to help inform the decision that the county needs to make. So we really appreciate the participant openness and honesty. So now, what did the county did with the data? They didn't sit on it. So this is why we need really dynamic leadership and commitment. So these are some of the resources for crisis that are available in the county. And you can see that's available on the website of the Breaking Through OBX, Mobile Crisis, call 911, or the National Helpline. What did they do following as soon as they get informed about the findings, we presented them. So here I'm gonna pause, because I am personally trying to advocate for that change in our behavior as researchers in academia. How many of us are academia here? Okay, good. So there's a trend and it's unhealthy. It's not okay. The trend is we would do community campus partnership, community campus research. But when we have the data, the conferences, the journals are the first one to get to know the findings. And that's not okay. So when we have the findings, when we have the data, no data should ever be published or presented without presenting it first to the community partners. Thank you. I'm seeing some applauding. That's the right thing to do. So we cannot ask why community don't trust researchers. It's because we lost that trust. They trusted us to collaborate with us, to conduct those research. But when it comes to getting the findings, we believe that we know better at writing. We might have some skill in writing academic papers, but let's humble ourselves. This is their data. Let's share with us, because they can take action while you work on that manuscript. And this is exactly what happened. So Dare County took actions. They developed a podcast to highlight local health, mental health concerns, and topics. They also collaborate with us on more additional grants. And then they develop a Credible Mind platform. These are not interventions that came from UNC at all. This is ownership, because they had access to the data. They heard what their residents are saying, and they take responsibility and accountability. They also developed put together a therapist and counselor community response team based on the feedback and the potential solution raised by their community constituent. Now, this is, if you would like to connect with Dare County, we are openly welcome everyone. These are the contact. Next step. Together, the team approach of centering the lived experience and cultural knowledge of the participant and resident in Dare County really can help us address collectively stigma. And future efforts should also focus on expanding mental health resources and support within the community, continuously engaging with their county members to address their unmet needs more effectively. And then we would like to end on some quotes from, we are very fortunate. So that we had our research project was accepted for the American Public Health Association conference this last year, so 2025. And unfortunately, our community partners couldn't make it. So we make sure that their voice were heard at that conference. So this is a quote from Dr. Sheila, who you get the honor to have here. I'm so fortunate to have her here. The inclusion and centering of individuals and groups most impacted was exemplary public health work. And then one of the co-chair of the Breaking Through Task Force, Kelly, also said that community partners shared that they had gained new perspectives for their ongoing work, and they now see through a new lens following this project. Because sometimes you have a perception but when people who are living the conditions tell you, oh no, this is what is going on. So now you have the reality and you act on it. So on that note, I'm going to turn over. That was the end of our research, but we didn't pause. We didn't stop on our partnership. And this is where you can understand the impact of collaboration and trust. And kudos to the first presentation on listening. Thank you for putting, having that foundation for our presentation, because listening is definitely so critical, because it's going back again to us researchers. Sometimes we have an idea in our minds, curiosity, but sit down. Please take the time to sit down. I just went through that project. I was like, oh, I know what I can do. And then I dropped an entire proposal. And then I sent it to Dr. Davis. And I said, what do you think about that for 2025 rural call for application? And then she went like, I will review it. She's so humble and said, but it's not a priority for us. I was like, oh, did I fell down? Yes. And I was like, oh, okay. What is your priority? Because going back to the listening. And then she said, well, we are facing that issue. And I was like, okay, would you be open if I start from scratch and then it's something else? She was like, oh, sure. And we did. And guess what? Listening to her.
Thank you. So before I jump into the next thing that we're going to get ourselves into, which if you can pick up on Dr. Excellent's energy, you can see where it's contagious, right? And so it's a great level of contagion, I would say. But stepping back to what we're doing, with the study and what's happening with our team, having that information, a couple of things that, with that data, it helped validate some of the work that they were doing. So we had just the Breaking Through Task Force and the work that they're trying to do with stigma. It validated that work is on the right path. We just need a lot more of it. And you mentioned the podcast. I'm really excited. Actually, the first episode was released last week. You can go to Spotify. And it was all about really trying to encourage people to break through those barriers now that we really understand those barriers more and get help. And that reaching out for help is not a sign of weakness. It's a strong sign of strength. And so it's a lot of strength there. So we will continue to build off of that. It helps my team. It's also helping with grant funding for us. In fact, I don't even think I shared with you, but we believe we now have funding to secure the Credible Mind and move that platform forward. So having the data is what funders, you can tell the story, but you need the data to match the story. And so that's another valuable piece that's going to help us do just amazing things in our community. So this next project that we're doing, and we'll just continue with the work that we are, but now we're going to focus on a new population. So we were talking about other challenges related to mental health. And we were talking about the young population. And under our umbrella, we also oversee a youth center. It's a center in Manio for at-risk children. And we run a summer camp. And I was talking with the director of the summer camp program at the end of this past summer. And we just moved into this amazing new, beautiful building. They built it for this program, the county. We have some incredibly supportive county commissioners who get public health, I will tell you. Regardless of political affiliation, they get public health, and I love it. They invested in building this amazing youth center. But at the end of the first summer in the youth center, the director was really frustrated because even though we had all of these games and activities and space to do this, the children wanted their technology. They wanted to bring their iPads, they wanted to bring their phones, and they complained when they had to go out and play kickball or dodgeball or soccer. Now, some of them didn't, but some of them did, the majority. And so they were really frustrated as a staff team. And so when we had this conversation, we actually did a quick survey just to kind of say, how do parents realize that this is an issue, and would they support any type of intervention? So we did a survey of the parents of the youth center after the summer, and overwhelmingly they responded they needed help. They recognized this. They're just as frustrated as staff. And that's kind of what set this new project that we're working on in motion. So we were thrilled when the announcement came that we were awarded the Rural Research Engagement and Advancement Fund Award. That's $15,000 that's going to go to this project, this new project. And it's focused on as the title says, Connected in Real Life by Promoting Healthy Alternatives to Social Media for Youth and Families, a Community Academics Resilience Initiative. And we're going to focus on the Youth Center. We've got interventions and some strategies. We're going to do some pre and post-test work to see if we can make an impact here. When we first put these slides together, our IRB application was in process. Pleased to say since then, I think just last week, we got notification that it was approved. And next Monday night, we will be kicking off the research and starting to open the platform with parents for surveys and then identify focus groups. So this slide here looks at our, goes a description of the project and our research team that we're putting together for this. And you've seen a couple of pictures here of the children. Dr. Excellent mentioned we do have a large Hispanic population. The youth center, probably I would say about 70% of the children that go there are bilingual. And so we'll certainly be taking some of the lessons that we even learned from the other study and applying them to the work, because some of the parents that we'll be working with do not speak English, or if so, it's English as a second language and it's limited. So we're recognizing that going into this study. So we're really excited about this. We'll wrap up with just a few acknowledgments here, certainly thanking the brave souls that volunteered and worked with us in Dare County to share their stories. You saw the level of data that we got, the openness. That's pretty phenomenal when you're talking about such a sensitive topic. Certainly thank, again, the Carolina Center for Public Service, the Tar Heels Bus Tour Grant, Dr. Excellence Department, the PHLP Department Chair and Mentor, Dr. Vaughn Upshaw with UNC-Gillings, certainly our partners in this academic process with UNC-Gillings, UNC School of Nursing, UNC School of Medicine, and the Community Health. This amazing audience, thank you all for engaging with us this afternoon, turning into this afternoon. Certainly UNC Rural for welcoming our presentation and including us as part of Carolina Engagement Week. And we both, last but not least, both believe in our strong faith in God and our amazing partners and supportive family. So, and our parents. We both are very blessed that our parents are still in our lives and are just a monumental impact. So thank you all so much. We are available for questions if you have any.
Thanks so much. And those that mic. Gabby, do we have a question on Zoom that we could start with?
Yeah, let me see if Gussie wants to speak it into the room. And if she's not able to, then I can ask it. So let me mute for one moment.
Hi, can you all hear me? Hi, Dr. Davies and Dr. Excellent. Thank you for your presentation. I'm sure you're not surprised to hear that I have a question. You both have dealt with me before. As both of you know, I live in Dare County, and I really appreciate you highlighting the very important cultural context about tourism-driven population surges during high season, as that's very unique here, although not unique in the entire state. I know the western part of the state has similar challenges, but that's a very defining influence that shapes daily life down here. And I'm curious if and how your research considered how tourism influences care-seeking behaviors among young adults here. For example, I'm thinking about during high season, many of locals work extended hours and feel this pressure to prioritize income while they're able to, sometimes delaying and foregoing mental health care. And some avoid, and this I'm guilty of this too, but some avoid traveling for appointments altogether just because of congestion and safety concerns, which makes getting around more difficult, especially those of us on Hatteras Island.
Yeah, thank you. Is this live? Can you hear me?
Yes, we can hear you.
Okay. Yes, thank you. And we did capture some of that in the interviews and focus groups, but because you live down south in our community, what you shared is absolutely the reality, and it's what we heard. There are certainly people that don't even attempt to get care during those really busy months between, say, May and September. And then that factors in if they wait and delay getting care, the situation certainly may be exacerbated, but then they fall into the fall and winter where they may not even have the income. So then that exacerbates the issue even further because now they don't have the money because they're often, our unemployment rate goes up during the off season. And then we find too, it impacts the families because a lot of families are working during that peak season, 2 and 3 jobs to make as much money as they can. But it pulls them out of the home and it pulls them out of that level of engagement with their family and their young children. And so we see an issue. We see issues related to that as well. So it's really complex, and the data that we received and the feedback that we received validated that as well.
No, thank you. I appreciate that context. And, to that end, I think when we're all avoiding going to the doctor during high season and, walking or riding our bikes everywhere, then come off season, we're all trying to go to the doctor at the same time. And then that becomes an access constraint that delays care again. So it's a pretty vicious cycle. Thank you both.
Yeah, and one last thing I'll say to that. One of the things that we are, and that's this Credible Mind platform that we're looking at, and also other ways to engage in telemedicine, telepsychiatry, teletherapy, may be able to play a bigger part in helping us deal with some of the seasonality issues.
Love that.
Hey.
Telehealth, and if we can all get Starlink down here so that we can actually get online to go to our appointments, that'd be awesome.
Thanks so much. And I do believe, unfortunately, we are running up to the end of our session time, but I want to thank you, Marilena and Sheila, for this wonderful presentation, for the people of Dare County for sharing, being willing to share this information. I know everybody here has learned a lot during this session. I certainly have, and it's very exciting to see the plans moving forward as well. And I hope that folks maybe could ask you questions further, et cetera, as we move into our break. So thank you very much.